Jared, there's a lot of fear about this virus right now, and doctors in Massachusetts are trying to calm those fears. But part of what's fueling concerns are these reports about possible Ebola cases here in the United States, including most recently one in Worcester. The Ebola virus has some people in southern New England on edge, but doctors say there's no imminent threat the deadly disease will come here.
It's one of those horrible viruses that's around. Is there any specific concern whether it would come to your state or whether it would spread? With modern infection control, that should not happen.
There is one case of Ebola in the United States and several Ebola scares elsewhere. On Saturday, our sister station in Springfield, WWLP, reported a possible Ebola patient being evaluated at UMass Memorial Medical Center in Worcester. The station says the patient has a history of travel to and from West Africa, and doctors have isolated the patient for public safety, although they don't believe it's Ebola.
One of our worries is, gee, what if it comes to a hospital? Say a patient walks in with a fever or abdominal pain or a lot of those vague symptoms in a hospital.
Dr. Najam Zaidi with South Coast Health in New Bedford says if an Ebola patient comes to his hospital, preventive measures are in place.
Healthcare workers have to take some special precautions, wear gloves, impermeable type of gowns. And as long as you don't get splashed by that patient, you're not going to get the disease.
Ebola is mostly confined to West Africa, so if you haven't been there recently, Zaidi says you have less reason to worry about catching the disease. Our sister station in Springfield reports that UMass Memorial Medical Center is working with the CDC and the State Department of Health on this possible Ebola case in Worcester, but that there's no threat to the public. With the Mobile Newsroom, Madeline Wright, Eyewitness News.